Hello, this is Kim Jong-il. Today, we will discuss twin block appliances. As for the first part, there are various functional appliances. Let's look at them and learn more about twin block appliances. Twin block appliances consist of two appliances, maxilla and mandible. There are various functional appliances. There are activator, bionator, Frankel appliance, Herbst appliance, Jasper jumper appliance, twin block appliance. Of course, there will be other functional orthopedic appliances in addition to these appliances. Class 2 Division 1. How should we treat in case of excessive overjet? Treatment varies depending on the differential diagnosis. Like A, the mandible is normal, but maxilla can be located anteriorly. Like B, the maxilla is normal, but the mandible may be located posteriorly. Also, like C, the maxilla can be located anteriorly, and the mandible can be located posteriorly. If the mandible is located posteriorly, it is an indication for functional appliance usage. If the maxilla is protruding, an extra-oral appliance, the headgear, can be used. And if the mandible is retruding, a functional appliance can be used to pull it forward. In the past, it was said that in the case of Class 2 malocclusion, the maxillary was often located anteriorly. But a recent paper shows that there are more cases where the mandible is located posteriorly. In other words, since the mandible is located posteriorly, it is highly likely to use a functional appliance. You can also use a fixed appliance. Many screws can be used to push the entire maxillary teeth backwards. Class 2 elastics can be used to move the maxillary anterior teeth posteriorly and the mandibular anterior teeth anteriorly. When treating such Class 2 malocclusion, first, it is necessary to determine whether the mandible is located posteriorly or the maxilla is located anteriorly. When the mandible is located posteriorly, it is called high-angle Class 2 and often has a steep POP. On the other hand, when the maxilla is located in front, it is called low-angle Class 2 and has a normal POP in many cases. How should we treat if the mandible is located posteriorly? The mandible located posteriorly must be pulled forward. Position the mandible forward and then flatten the POP. If the maxilla is located anteriorly, you can move the maxilla to the rear. At this time, it is recommended to keep POP as much as possible. Functional appliance indications are excessive overjet, full Class 2 or half Class 2 non-extraction cases. The look at the edge-to-edge bite should be good. For non-extraction treatment, crowding of the mandibular anterior teeth should not be severe. Functional appliances basically increase the vertical dimension. First, the activator is a functional appliance that was first introduced. The problem is that the tongue may lower due to lack of space. Bionator is less bulky than the activator. This appliance must also be worn full-time. The Frankel appliance receives force from the lips and cheeks, and the advantage is that the tongue can move freely. However, this appliance is much larger than an activator or bionator. It is uncomfortable for patients to wear. Herbst or Jasper jumper can be used with a fixed appliance bracket. The problem with the Herbst appliance is that the patient is likely to be uncomfortable. The jaw is restricted when it moves laterally. Jasper jumper is not good for oral hygiene. It can also break easily, and it can cause irritation on the cheek. The advantage of the twin block is that it is comfortable to wear compared to other appliances. It is also easy to add expansion screws. The problem with this appliance is that it has to be worn full-time. In the case of Class 2 malocclusion, the vertical dimension increases when the mandible is pulled forward. There is a freeway space between the maxilla and mandible. Remove the resin plate to extrude the mandibular first and second molars to freeway space. What will happen to POP if you do this? POP will be steep. Functional appliances are important. The occlusal plane is also important. Which is more important? I put more emphasis on occlusal plane control. Fit is recommended to use a functional appliance to pull the mandible forward and then strategically level the dentition. If the vertical dimension increases and the POP is flattened, Class 2 malocclusion treatment becomes easier. When the mandible is pulled forward by using a functional appliance, the mandible comes out anteriorly. Rather than extruding the mandibular posterior teeth in the space generated, stability is obtained by flattening the POP, uprighting the mandibular molars by strategic leveling. This is the control of the occlusal plane. So, the control of the occlusal plane is more important than the functional appliance. What are the advantages of twin blocks? 1. The vertical dimension increases. Overjet is reduced. 3. It is easy to obtain proper arch form. If there is a posterior crossbite, it is easy to expand the posterior region. But the problem is that the patient has to wear the appliance. There are limits in adult patients. If the patient does not wear the appliance, it has no effect. Let's look at the vertical dimension. In conventional orthodontics, Class 2 malocclusion is resulted from the posterior teeth of the maxilla were extruded and the mandible rotated backwards. In other words, it is said that the anterior vertical dimension has increased. Therefore, in conventional orthodontics, the vertical dimension is reduced to treat Class 2 malocclusion. In conventional orthodontics, there is no mention of posterior vertical dimension and POP. In contrast, Mia orthodontics emphasizes the rear rather than the front. In other words, it is said that the posterior vertical dimension is reduced in Class 2 malocclusion. This is expressed as steep POP. Therefore, in mio-orthodontics, we increase the posterior vertical dimension to treat Class 2 malocclusion. The anterior vertical dimension varies from patient to patient. Anterior vertical dimension may increase or decrease. Increasing the posterior vertical dimension is a very important factor in mio-orthodontics. To increase the posterior vertical dimension, which is better, a fixed appliance bracket or a functional appliance? Functional appliances are better. If a fixed appliance and mini screws are used, the vertical dimension will decrease rather than increase. It should be evaluated whether increasing the vertical dimension is beneficial for treatment. First, evaluate the profile at the edge-to-edge bite. I pay attention to this sheet when making a diagnosis. First, look at the profile aesthetic. In case of Class 2 malocclusion, the maxilla may be protruding and the mandible may be located posteriorly. It is important to first look at the profile at the edge-to-edge bite by moving the mandible forward. Moving the mandible located posteriorly to the front like this causes the improvement of the antero-posterior relationship. What does a positive profile aesthetic in edge-to-edge bite mean? For this patient, increasing the vertical dimension means that the treatment is beneficial. This patient has an excessive overjet. If you look at the intraoral photo in CO bite, the canine key is full class 2. But if you look at the edge-to-edge bite, you can notice that it is a posterior crossbite. In other words, it is a case where the mandible is located posteriorly because the maxilla is narrowed. What does the case with the protruding profile at the edge-to-edge bite mean? It is a case of protruding maxilla. Of course, the mandible can be positioned posteriorly as maxilla protrudes. Or it may be a case of increased lower anterior facial height. In this case, non-extraction treatment is difficult. On the other hand, if the profile in the edge-to-edge bite is good, the mandible is located posteriorly. Or it is a case of lack of vertical dimension. As it increases vertically, the profile becomes good. In this case, if you look at class 2 malocclusion, it is transversely narrow. Compared to class 1 malocclusion, in class 2 malocclusion, the crown lingual torque of the premolar is large. The intercanine width is reduced, or the TPW is narrow. In this case, expansion is required. Among the functional appliances, the appliance capable of expansion is the twin block. You can improve the antero-posterior relationship by expanding the maxillary arch in the twin block. Overjet is excessive. You have to make this edge-to-edge. To do this, you need to acquire a construction bite. When the mandible is pulled forward, the POP may be flat or steep like this. Which cases are easier to treat? When POP is steep, treatment is easy. This is because when the open coil spring is used in tooth number 6 area, the mesially angulated mandibular second molars are uprighted, and there is a high possibility of contact with the maxillary molar. If the POP is flat, all posterior teeth must be extruded to complete the occlusion of the posterior teeth. Construction bite registration is important. In what state should bite be registrated? In antero-posterior relationship, class 1 canine relationship and edge-to-edge bite are good. In the transverse, the maxillary and mandibular midline should match. In vertical, it is recommended to obtain 2 to 3 millimeters of interincisal clearance. There is a case where the overjet is larger than 7 millimeters. For cases where the overjet is smaller than 7 millimeters, you can acquire bite in edge-to-edge bite state. When the overjet is larger than 7 millimeters, the patient feels uncomfortable when the bite is acquired in edge-to-edge bite state. In this case, it is better to pull the mandible out in 2 stages. It is advisable to first pull out about half the length and activate the twin block. The amount of vertical activation is important at this point. There should be 2 millimeters clearance at the anterior teeth, 5 to 7 millimeters at the premolar, and 2 millimeters clearance at the posterior teeth. I use a pink base plate wax to register the twin block bite. Make the base plate wax into an arch form. After letting the patient practice, put the wax in the mouth and close it. Normally, let them stop closing when 4 millimeters from the anterior teeth. When the clearance is 3 to 4 millimeters in the anterior part, if the patient stops closing it, it is closed a little more by the strength of the muscle. As a result, we can register 2 to 3 millimeters of the anterior tooth clearance. Soak the finished bite in cold water. What you have to make sure when to register a bite is that there should be a 2 millimeters interincisal clearance, 5 to 7 millimeters in the premolar, and 2 millimeters in the posterior part. This is a case of Class 2 Division 1 with excessive overjet. The posterior vertical dimension is reduced. POP is steep. The mandibular incisors are extruded, the curve of SPE is severe, and the mandible is located posteriorly. How should we treat this? The posterior vertical dimension needs to be increased and the POP needs to be flattened. Increasing only the posterior vertical dimension has limitations. POP needs to be changed. The curve of SPE needs to be flattened. The mandible must come out anteriorly. Before flattening the POP, the author first pulls the mandible forward. The appliance used at this time is a twin block. Strategic leveling while using twin blocks. Strategic leveling is to use an open coil spring on tooth number 6 after arranging the anterior teeth. Flatten the POP, level the curve of SPE, and increase the posterior vertical dimension. The use of the twin block restores the canine relationship in the oral cavity, and the crowns of the premolar teeth appear slightly longer. The vertical dimension has increased. But in the superimposition, the mandibular plane angle did not increase that much. In other words, as the premolar part, which was located at the lowest point, is extruded, as the POP changes, improvement is achieved. Strategic leveling after using twin blocks. The first order bends are improved, as the maxillary appliance includes expansion screws and performs strategic leveling. When the mandible is pulled forward, space is created like this. Strategic leveling is performed after space is created, so the meshally angulated mandibular second molars are easily uprighted. Lingually tilted teeth can be buccally uprighted by expansion appliances or non-extraction treatments. So, strategic leveling while using twin blocks can lead to good results. Twin block consists of the maxillary and mandibular appliances. Let's look at the modification of the twin block. First, only the maxilla can contain expansion screws. In this case, you can design the Adams clasp on the maxillary tooth number 4 in tersex. Later, when arranging the front, you can cut the Adams clasp on tooth number 4. Second, both maxillary and mandibular appliances can contain expansion screws. When expanding the mandibular arch, it is recommended to expand the resin plate to the lingual side of the mandibular tooth number 7. While expansion, mandibular tooth number 6 and number 7 can be buccally uprighted as well. It is advisable to design the Adams clasp in areas tooth number 4 and number 6 in the mandible too. Third, asymmetric twin block. Bite blocks are located diagonally. It can also include expansion screws. Have a look at this patient. The midline was deviated to the left. All the muscles will try to move to the left. However, the left resin bite block of the mandible is located in front of the upper resin bite block. What if the resin bite block on the right side of the mandible is also located in front of it? There is a gap between the upper and lower right resin bite blocks. When there is a gap, the muscle keeps pulling, so the left improvement is not easy. How do you compensate for this? The resin bite block on the right side of the mandible is placed on the posterior side, and the resin bite block on the maxillar is on the anterior side. This will prevent the mandible from moving to the left, as there will be no gap here. This is called an asymmetric twin block. In patients with a deviated midline, the midline can be aligned first by using an asymmetric twin block, and the upper and lower occlusion can be aligned. With the twin block, it is possible to increase the vertical dimension, and transverse problems can be easily solved, especially when the maxillary or mandible is narrow. As a prerequisite, the profile should be good in edge-to-edge bite. Indications are cases of large, deep bite overjet and lingually tilted maxillary molar teeth. With a fixed appliance, you can strategically level and put Mio in the final stage. Strategic leveling is to use an open coil spring in tooth number 6 area after arranging the front part. In such a case, arranging the front teeth using a twin block can maximize the treatment effect and shorten the treatment period. You need to know about attaching a fixed appliance bracket using the twin block. It is similar to attaching a bracket using an expansion appliance. I will explain it in detail in the second part. Thank you for watching.